Welcome to Uncaged. Today we're speaking with Dr. Liz Kwo. Liz is an expert on digital medicine. We're going to be talking about a lot of the things that she's been working on in the digital healthcare space. She is the chief commercial officer at Everly Health. She's also a faculty lecturer and physician at Harvard Medical School. She sits on a variety of boards, but she's very passionate about this idea of digital healthcare. So we'll talk a lot about kind of the things that she's working on in that context. But before we get there, Liz, tell us a little bit about you and your career.
Sure. I went to medical school and business school thinking that I would want to be at the intersection of technology, medicine, and business. Because I thought if you had three legs of a stool, you would want to understand how business is run, who pays for healthcare. On the medicine side, you want to understand the clinical indications, what changes outcomes. And then on the technology side, it's the only way to scale a lot of really great opportunities. So that's a quick background. I grew up in San Francisco and came to Boston for medical school and business school and never really left. And I also have three kids that I'm very grateful for and a very supportive partner with all the things that I work on.
So I know that there's a lot of stuff that we want to tweeze through today, Liz, but tell me a little bit about some of the things that are top of mind for you that you're working on right now.
Absolutely. I think so right now I'm coming out with a book called Digital MD, The Future, Revolutionizing the Future of Healthcare. And I really believe that we're at this crazy inflection point of all this amazing data, all these really outcome-driven clinical interventions, precision genomics, remote patient monitoring, all the things that we never had access to 10, 20 years ago coming together. So I wanted to write a book just to help people understand how those get paid for, even what cell and gene therapy, which will be multi-million-dollar per year drugs, are going to do for healthcare, but also how we need to change the landscape of how we're thinking about the return on the investment. Also, I love this idea as I've been thinking a lot more about not only digital health, but how do you also support entrepreneurs in the innovation side, thinking about, I call it sort of the 5 Ps, the pioneers, payers who pay for it, also employers, policymakers, patients, and then ultimately physicians and or providers, clinicians, nurses, and how we support that as a healthcare system. So with these, I wrote about just this idea of how do we support and build this ecosystem together.
Mm-hmm.
Uh, it's also led me to think about a second book that I'm working on, which is this idea of code blue to code breakers. How do you help clinicians get into healthcare and become healthcare execs?
I love it. I love the book. And I think that there's such a need for a larger dialogue about a lot of these things. And perhaps also, I would say, just shedding more light on what is going on. Over the last couple of years, we've lived in a strange era where we've all worried probably more about our health than ever before. We're living through the pandemic and rediscovering a world outside of the pandemic. And tell me a little bit about where you think we are right now in terms of maybe the adoption of some of these benefits that you're highlighting and maybe some of the challenges that we still face.
Absolutely. Some challenges, I think, continue to be how do we give access and affordability to patients in more rural areas? How do we increase our bandwidth, our ability, even for Wi-Fi and others to reach those? I would say adoption also, I mean, we accelerated very quickly. People are now doing home testing for all sorts of things now because we're comfortable with physicians not even reviewing the lab tests and still prescribing, let's say, Paxlovid for COVID. At the same time, we're also really exploring how do we do it in the confines of FDA regulations with AI and digital health and companion diagnostics. There is more and more regulation that we're starting to see around data privacy, cybersecurity. But there's also a lot of questions about user and term agreements within apps that you download and where that gets shared and how is it utilized. I see a lot of this within also lawyers actually talking to me about how do they set something up with this kind of contracting language, who owns the data ultimately, and how can anyone monetize it if they want to. So we're at this inflection point. It's really exciting. It's also sometimes some people say nerve-wracking about where we can go. And I want to also, talk a lot about, I've been focusing on this idea of equitable care because a lot of things are happening, but how do we make sure that people that need the care are getting the care and they're at the right place, right time with the right type of
Well,
care?
let me ask you a question. So I'm generally kind of feeling very much like you're an optimist. that you
Yes.
see that there's a bright future ahead for us and it's exciting. However, I mean, the reality is that, I mean, we live in a country right now where for most individuals, the healthcare system is broken. Tell me how I get to feel like an optimist on this. What are these things that you're excited about that are going to be the building blocks to get us to that future that you're outlining?
So I find I'm just generally an optimist. I fail a lot in a lot of things, and I that it's okay to do that. I usually have 20 ideas anytime going. And I believe even if it's 50% of those get actualized, I feel like that's a win.
Yeah,
I think same with healthcare. We sometimes need a trial and error, like anything in startup world. And I do think that people mean to come into it with the right heart. Most people that get into healthcare do it for the right reasons, right? They want to support people. They have a personal story or a family member or something that they've experienced, and they want to change the status quo. I
yeah,
think we have people in the right places. I think sometimes it's a little bit takes some more time than we would want. But I think the idea is our biggest burden is living with our own thoughts. And so the past is this memory, the future is in your imagination. So how do we create the reality that we want in the present and focus on what we can do now rather than sort of think about some people talk about robotics taking over, AI bots and things like that. I also believe in this idea that we have some great pioneers changing the world, like doing some incredible things.
yeah,
We're starting to move people out of hospitals into the home, whether it's in palliative care and or in other places. We're trying to reduce hospital infection and rates by also letting people do remote patient monitoring and other things.
yeah.
And
It
we
just
didn't
seems to
know.
me that like a lot of stuff in the digital space, there's a lot of, I'd say, common sense digital that could
Mhm.
just be amazingly impactful. And I think one of the just the personal experience was I relocated to Miami from New York during COVID. I was able to, for a while during COVID, to speak to my doctor in New York until one day he said, sorry, can't do this anymore. They just passed a regulation. I'm not allowed to, talk to you if you've become a resident out of state. And it was one of those moments where you're just like another another regulation stopping something that was clearly beautiful use of technology, right?
Yeah.
And so I'm excited. I share your enthusiasm. I think there's so many things that can improve the quality of health for so many people. Always kind of seeing us get in our own way somehow. Trying to figure out how we get out of our own way.
Yes, I know we do. I tend to think though there are reasons why, it's healthcare is life or death, so a
Yeah.
lot of times you do want something that's regulated in the right way. But you're right.
Hmm.
I think sometimes we overcomplicate things as a system.
Yeah. Well, I mean, when you think about all this stuff that you're doing, I mean, Liz, you've had some incredible experiences working with entrepreneurs in the healthcare field, obviously practitioners, you being a practitioner yourself, starting companies. Where does the passion come from for this space for you?
Sure. I think uh I think for my parents, they always taught me that you have to, in order to help other people, you have to have your own education, means, resources. And so I think I always started young thinking I needed to accumulate degrees and or experiences and get to know people. Over time, I've realized that not only is it that, but it's also, the drive and the ability to see and connect the dots
Hmm.
and say, I know this skill set, I know this person, I have this opportunity. Why don't I try to build that together with the people that I trust? And that's where it comes from. It's like the desire to create.
Hmm.
I also feel like when I have spotted opportunities, I'm sort of an opportunist. So I kind of explore as much as I can. And then I say, okay, I'm ready to jump into it. Um, I will say I started a digital education company a few years back, and then I came back to the U.S. and I was working for a company called American Well.
Hmm.
Uh, Great people, and it was the first of its telehealth kind. And at the time, unfortunately, ended up having a stillbirth. So I lost my first child at 9 months when I was pregnant. And so full-term pregnancy loss, and that sort of threw me in a tailspin of what could I have done differently? Could I have checked
Mm.
his heart rate? Could I have been more monitoring my own symptoms? And I realized that if I would have had digital monitoring or the ability to consult a specialist, I myself, even as a physician, didn't always meet or know the signs. And so I started a second opinion company thinking through how do we support people that are in these sort of tragic events or life-changing events and wanting to understand more and getting
Mm-hmm.
special, I would say, experts in this field. And so that was a company called Infinite MD that we started. And it was important for me to channel a lot of my grief and sadness and questions into
Yeah.
something that was more meaningful. And since then, I've just been continuing down this path of digital health and focusing on how do I support more people. When I worked at Elevance Anthem Insurance Company, it really opened up my eyes into how our healthcare system works, how the sausage is made, from Medicare to Medicaid and self-insured employers and how they cover services. And so it's just been a wonderful journey.
Well, Liz, if you can figure out a way that I never have to fill out another health form with the same information, I will invest in that company for sure.
Yes, everything's trying to get digitized. That is correct. On the provider side, it's also filling out paperwork after paperwork of prior authorization for
Well,
drugs.
I mean, obviously, I've worked in the digital space, and I remember talking to a physician a couple of years ago, and I filled out a Xerox form that they put on a tablet to fill out in an office, and then I presented it to the assistant, and I said, just for my kind of like curiosity, where does this go now? And she says, oh, well, we fax it to a group in India that then puts it into a computer for us. And I was like, oh my God. Like, we can get these things
I know.
improved for sure.
Right now, we're using a lot of AI and NLP, natural language processing, to reach into medical records, pull that out. So in the future, you may not ever have to fill out a form. That's going to be the
Hallelujah.
um, all these EMRs, electronic medical record systems, are integrated with the payer side. Then it's foresee just like real time check the box. You have these three things that qualify for you for an MRI, and then getting
No, I
that
mean,
done.
I love it when you apply this stuff. It's excellent. My physician has an app where it essentially connects into my iPhone, all of my Apple data, right?
Yes.
So she gets all of that. And, every 6 months, she's kind of like telling me like what she sees. It's great.
Yeah.
It's a game changer for me.
Yeah.
So,
There's going to be health
right.
assistance, feature, companion support, data analysis to like predict, prevent, prescribe, booking appointments, things like that. And healthcare worker shortages will hopefully, support this will support all of that.
Yeah, just make pizza healthy for me, please. That's all
I
I
know,
need.
seriously. Me too. I love pizza.
So let me come back to the family question, because I know that you are very family oriented. You've got three wonderful kids. Tell me about how you're balancing all of this stuff.
Oh, it's tough, but I think my goal is whenever I travel, I write little notes to the kids. I put down like little eggs, like Easter eggs around so they can find them or presents. But I also why I try to be there for important things. I've missed one or two, teacher breakfasts, and I've like never lived those down. So I try to move my schedule around to support that. I have a partner who's very supportive and also a lot of help. I'm lucky enough I do outsource. One thing I would say is, I mean, even with technology, Amazon, Walmart's, Costco's, you're able to deliver to the home. And so I use a lot of that. And ultimately, I think my goal has always been to make sure that they know who I am as a person and they want to spend time with me.
Hmm.
So I prioritize when I'm on trips, sometimes with work, I will write them notes. And I've actually compiled books for them over the years. So I'm working my volume three. Basically, they're called love notes to my kids. And
Oh,
hopefully one day, when they're old enough to read through little things that they said that were just hilarious to me, or the day where they're like, I hate mommy because she always travels. And I'm like, I can still write that down and kind of laugh about it.
yeah. Yeah.
It's tough to be sometimes away, but also it's tough sometimes to feel like you're balancing everything. But like you said, I'm an optimist. So I try to
Yeah.
think, I want to maximize everything. And if
Well,
I
you're a
can,
problem solver too. I can see that. So you're someone who sees kind of like challenges and you think, oh, well, why don't we create a business for this? Why don't we fix this? Why don't we change that? And that's excellent. I mean, I think that's the type of thinking we certainly need in the healthcare profession. And I mean, I'm hoping that your optimism extends into 2024 and that you see bright things ahead. When you put your Nostradamus hat on, what are you seeing?
oh, I see a lot. I think we are going to see a lot of retail getting into healthcare, so it's more accessible. Even for Walmart, I'm on the board of Walmart Mexico and Central America, and we know 90% of Americans can drive within 15 minutes of any Walmart. So there's goals of, making that more accessible for healthcare and for purchases for healthy lifestyle. There's also this goal right now of, as we see in 24, over-the-counter medications. A lot of things are going off patent, or FDA is going to now approve it. So we're seeing that. Home testing is a big one, remote patient monitoring so that we can all take our blood pressure and our medication the right time. And we're seeing precision genomics where now you can figure out what your migraine medication should be rather than sort of testing and trial and error, to be able to take a test for $100 and know that this migraine medication is best for me. So I'm excited to
Wow.
see that unfold. We're seeing a lot of the ways that even when we're developing research drugs, we're seeing the way that, driverless cars are able to not hit certain roads, road signs. That's going to be an interesting way, because AI and the modeling around that with I think Neuralinks is going to be very, very fascinating.
I mean, certainly going to present new challenges. I'm sure that we'll read about something exciting that's possible with that possibility in the very near future. Liz, it's been amazing talking with you. If someone wanted to learn more about your book, Digital MD, or any of the businesses that you're working on, you as a physician, where's the best place to reach you?
Oh, well, I do have a link called, it's Dr. DRLIZ Liz Kwo, KWO.com. I've been answering emails, and I'm happy also to have people pick up the book if they're interested in connecting with me about it. It's called Digital MD, and it's on Amazon and all retails. And also just find me on LinkedIn. I have been responding to messages. I don't always get to everyone, but I do try to as much as I can. And I just really enjoy connecting with people, because ultimately I feel like that's what makes life go round. It's the relationships.
That's awesome. Well, Dr. Liz Kwo, thank you so much for being on the show today. We've been talking to Dr. Liz really about all of the breakthroughs that we're seeing in the healthcare space, a lot of the innovation, as well as how it's being applied to some of the challenges that we face. We've read a lot about telehealth. We've seen a lot of the stuff that's happening in genomics, but how is all that stuff coming together, and how is that going to impact our lives? Take a look at her new book, Digital MD. She makes it very easy for all of us to understand where we are, and we look forward to seeing the next book from you very, very soon.
Thanks so much, Ben.
It's been great having you on the Uncaged Show, and we look forward to having you back.